We work with some people who've got some challenging circumstances, and we need that information to be available real time as if there's any changes. We have some great people, we do some wonderful work, but it requires systems and processes that are going to enable them to deliver that in the most effective and efficient manner.
We're a very diverse, not-for-profit organisation, and that comes at a price. Mm-hmm. But it shouldn't stop us from making our systems appropriate for the future and looking for the commons. So the common is CDC. Mm-hmm. The common is we have to be able to communicate with and be responsive to our customers. The common is we've got to make our environment attractive for our workforce.
We've used lots of different systems along the way, and this will be the first time with an ECMS that we will be able to have one single view of the customer. We're much more interested and able now to provide people with the journey from Uniting Care Health or to Child and Family, in and out of Blue Care, and from a whole of organisation perspective, while our clinical systems might in fact be quite different, there's still a need for us to know that those people are moving across our organisation, and we want to facilitate that journey and make it easier for them to be able to access all of the services that Uniting Care can have. In the new regulatory environment, when we're talking about consumer direction, people will make choices to go to the services who can make their customer journey and their experience as seamless and as efficient as possible. And so the more we move into an unregulated marketplace and there's competition, the more we are going to need to bring to market a more competitive value proposition.
One of the key benefits, I think, for the new ECMS for customers will be the ability for them to really engage in the provision of their services, to track and monitor what they want, to request particular staff members, and to really have their family networks buy in to all of their supports. We have families who have been very disengaged from the supports of the people they love, who have got multiple services happening. There's no way to track it, and it's all quite confusing for people who also have their own day jobs and other children to deal with. Having this client-facing portal, for example, will be a godsend for them in being able to manage all of their supports efficiently, and really place Uniting Care as being a provider of choice for families.
The personal carers, the registered nurses, the allied health professionals, who to a degree are probably flying a little blind when they're out there. Yeah. They're great at delivering the care, no doubt about that. But if a client wants to know anything other than what's going on for them right now, right this very minute, or a family member happens to be there and asks a question, the frontline worker is a little blind to what's going on. If we can get the right care provided at the right time into our clients' homes, then that's a much better outcome for them.
People with disability having real control and real choice and living the life that they want. Going forward, if we want to, it's going to be it's already tough, it's going to get tougher on how do we attract the quality of workers that we need. Quality and capability, quality and attitude.
Our staff come to us because they have a passion for supporting people, and the more we can reduce the amount of time in administration and the boring things that people have to do so they can actually get out there and provide supports to the people and do the things they love and have that sort of passion and energy being a signature of the Uniting Care services.